guys, what's up? So today's video is going to be part of a new series that I want to make called Nursing Survival Guide. So basically I'm going to go through all of my classes or some of my classes that I had my first semester and basically tell you how I survived them. I usually don't talk about my grades because I don't want to throw it in people's faces, but I did make all A's my first semester of nursing school, so I think that my tips can help you and maybe you can learn a little something from them. So today's video is going to be the survival guide for fundamentals. I believe most schools have fundamentals classes. If they don't, I'm sorry. You might have a class similar to this. For my fundamentals class, basically we are doing obviously the fundamentals of nursing, and this class also had our clinicals. So in the clinicals, we were learning the basic stuff that nurses do in the hospital, like catheterization, bed making, you know, simple things like that, oxygen, etc. So I ended up having 5 books for that class. There's a checklist book, a dosage calculations book, which I never used. It was not necessary in my opinion. And then a nursing diagnostics book, and then the 2 books that I have right here that I used most often. This one is the Fundamentals of Nursing. This was basically what we used for clinicals. If you needed to, it basically tells you how to do procedures and things like that, you know, proper way to do PPE, etc. And this was the giant book for the classes and the lecture. So basically my point of presenting that to you is that for my fundamentals class, I had lots and lots and lots of resources and lots of things to know and look over. So my point of that is you need to take your time and manage it wisely. It's not necessary to read everything. I can tell you honestly that I read before class for the first day of school. I read the entire chapter that we were going over that day, and it's not necessary. It's about your quality of time, not your quantity. Like I've said before, I rarely studied past 6, rarely, maybe like 2 or 3 days throughout the entire semester. So I would only read things within this book that I absolutely needed to read. For example, most of you, if you've seen my how I study for nursing school video, I make study guides, and basically my study guides are a compilation of things that are in the lectures, like verbally said in the lectures, and then things that are in the PowerPoint, and then I put them together, and then if I feel like I'm missing a little something, then that's when I went to the book, I read it, and I added it to my study guide. Hope that helps. So basically, we were still tested on our clinicals, like basic procedures that we learned. In the clinicals, we're on our lecture test as well. However, I never studied for that. I never studied that portion. If you pay attention within your clinicals, you will not have to waste your time studying on that. The first thing is budget your time wisely. I've said that over and over and over again, but it's really important. Also, you need to pay attention in class, take your notes. If you need to, record your notes, and any time that the teacher says, do a practice question. My teacher did that like maybe 4 times, but every single time that question was on the test, and I wrote it down every single time, so I always got that answer right. So for fundamentals, it's important to know that, you know, you're gonna be focused on different things. You're focused on the proper way to do certain activities. You're focused on ADPI, which is the nursing process. You're focused on Maslow's, you know, the patient's needs when you're doing questions. You're not focused on what the disease is. You're not focused on how that disease occurs, you know, what kind of pathogen it is. That's not what this class is about. So you need to be focused on the proper procedure for example, you know, sterile field. I cannot tell you how many times we had questions on proper ways to manage a sterile field. So, you know, you just need to pay attention to that kind of stuff. And basically just the way that you are treating the patient, how you should treat the patient, and things like that. But teachers are gonna tell you over and over and over again not to change your answers. While you're taking the test, usually what you think is right the first time is right. So I recommend not changing your answers. I have changed my answers multiple times on tests, even though I was told not to, and sometimes I do get it right, but most of the time I end up getting it wrong. And they're not trying to trick you. I know I have read into so many questions so much deeper than necessary, and I end up getting it wrong because of that. Also, I recommend, as I said in previous videos, getting a medical dictionary app. That way, if you see a word or something you don't know, or a word that you don't know, then you can easily look it up. Another important thing, you're just gonna really need to grasp onto the main ideas of this course. Like, You need to know the procedure for the various tasks you're learning in clinicals. That's an obvious, but you also need to know there's gonna be like prioritization questions where, you know, it'll either be the ABC, airway, breathing, circulation. That can help you. Also, Maslow's hierarchy of needs. If you don't know what that is, look it up. It'll help you a lot when you're looking at the Nclex style questions on, you know, on how to take care of patients. Additionally, you're going to need to know the scope of nurses and also the scopes of LPNs or LPNs, CNAs, and know like the difference between the two, because there are going to be, if your class is anything like mine, there will be multiple questions on delegations and who can do what task and what task you can legally delegate to other people within the hospital. In fundamentals, you're gonna get a lot of stuff that is just stuff. Like a lot of stuff is going to be thrown at you that you're probably never going to use again. For example, we learned the various types of knowledge, the theoretical, the ethical, the practical knowledge. If you don't know what that is, you will probably soon find out, but those are things that you're gonna have to memorize and you're probably never going to use again, but you're going to need them for the test. Speaking of memorization, for things like that, those are things that I memorized, but when it really came down to it, it's going to be way more about understanding the topic. If your school does the Nclex style questions, the questions are going to be so crazy that if you do not understand the basic concept, you're not going to get the question right, and if you do, it's going to be because you guessed. There are going to be questions where all of the answers are right, but it's going to say what is the most right question, and that's when it's really going to be hard for you if you don't understand what it's talking about. Also, there are select all that apply questions where you're going to quite literally have to select all that apply. And yes, I have had questions where all of them were right, and I sat there like, is this right? Should I be selecting all of them? But don't second guess yourself. So within this class, I can tell you that I came up with multiple mnemonics, is that the right word? Yeah, mnemonics to help me pass the class. And basically get down things that I need to get down really quick. For example, the ADPI. I'm sure many of you have heard that. It's the nursing process, the assessment, diagnostic, planning, implementation, and evaluation. Also, in order to do well in this class, you're going to have to get good at doing nursing diagnoses, because you're going to be doing that a lot. And they're going, in my class, and on the HESI, there were multiple questions where it was like, which one is the proper nursing diagnosis? Or what is an appropriate goal for your patient? And if you don't get this right the first time and you learn it wrong, then it's not going to be okay. For example, you know, you're gonna need to get down the differences between an at-risk diagnosis and an actual diagnosis if somebody has the signs and symptoms. If you want a video on how to do a breakdown basically of the nursing process, it's really not that hard if you break it down properly, and I think I can do that for you, and I think it may help. So let me know if you want to see that. Some of the stuff in fundamentals is going to be tedious to learn because, you know, you inherently know the information, you just now need to bring words to it and be able to be tested on it. For example, the stages of dying, that was something that, you know, you already pretty much know, but then you have to know in detail and be able to be tested on it. Back to the time management, I know I've talked about this so many times, but, you know, it's something that right now you're like, she has said this a million times, I do not care, but trust me, you will have times. We had 3 or 4 tests in 1 week, and if you were dedicating time to things that just didn't need that amount of time dedicated to it, you know, you're gonna be screwed. So for example, in my fundamentals class, we had online case studies that you could take multiple times, and honestly, for me, they didn't provide much knowledge or information, so I just took it multiple times, didn't spend too much time on it until I got 100, and did not waste my time on that. I went ahead and got my Nclex study book. It has a large fundamental section just because I wanted to read you guys an example of questions so you can kind of see what I'm talking about when I'm talking about Nclex style questions and how crazy they are. Okay, so this was what I was talking about when I was talking about you need to know how to prioritize patients, whether it be by Maslow's, whether it be by ABC, and actually, quite honestly, who's gonna die first. So this is one of the questions that I'm gonna read for you so you can get an idea. And it honestly might be good for you to get this. I got this before school started and I started looking at it because I'm a nerd. Okay, so the nurse employed in an emergency department is assigned to clients coming to the emergency department for treatment on the evening shift. So already the question is giving you so much information that you don't need to know. The nurse should assign priority to which client? A, the client complaining of muscle aches, a headache, and a history of seizures. B, a client who twisted her ankle when rollerblading and requested medication for pain. 3, a client with a minor laceration on the index finger sustained while cutting an eggplant. 4, a client with chest pain who states that he just ate pizza that was made with a very spicy sauce. So already I know that I'm going to put priority to the person with chest pain because, again, the ABC, if somebody's having chest pain, it could mean that they're gonna have an MI, so you're gonna put them first. Sorry if that was like so extra, but I wanted you guys to see what a question's going to be like and why it's so important to know the basic concepts so that you can get and understand, not memorize, understand, because when you get questions like that where you're like, I don't know, you can very easily pick out the right answer. I hope that I helped you out. The main thing for fundamentals is you need to know the fundamentals and the basics of nursing. Once you can get those down, you can just build upon the other things that you may learn, like difference between genders, how to approach them, sexuality, culture differences. You will learn those as well. And sometimes it might just be you have to spend a little extra time to know that, like the cultures. Sometimes those are very hard to learn. I remember I just wrote them out a couple of times and then I would continuously read them. For example, you're gonna need to know who can eat meat and who can't, who can give blood and who can't, who will accept organs and who won't, and not, you know, the proper way, who can decide what happens to a person if they are dying or if they are brain dead. So that's going to be something to look forward to. And also, you're going to need to know your lab values. Those were so tedious, and the thing is, when you're in a hospital, your computer system will probably tell you if it's high or low, but it's still something you need to know for yourself. But for that kind of thing, you just gotta write it out over and over and over again, and hopefully eventually you will get it. So the most important thing, and this applies to every class, you need to know you. You need to know the way that you can learn and the way that you like to study and the way that works best for you. Some people can just listen in class. I don't think that will work for nursing school, but some people can just listen and get the answers correct. I don't know how. And then others, they have to write it out over and over and over again. I have friends that will literally write their notes out a couple days before the test, whatever. And for me, I have to put everything together in a study guide. I talk it out loud to myself. That sounds crazy, but that's what I do. And I read it, and then I'm ready to take the test, and that works for me. So yeah, I hope this helped. I think next I'm going to be filming either what's in my nursing backpack video or another, I'm gonna do both, and a video on how to pass pathophysiology. So yes, I hope this video helped you, and if you have any questions specific for fundamentals, you can comment down below and I will respond. I always read the comments, and if you haven't subscribed already, what are you doing? So until next time, bye!